week ago, Italy had so few cases of coronavirus that it could give each patient in intensive care a bed if necessary. Today, some hospitals are so overwhelmed that they simply cannot treat every patient, and their approach today is something close to wartime triage. The Italian College of Anaesthesia, Resuscitation and Intensive Care has issued guidance it says other European countries will need to follow. There may, it says, need to be an age limit for access to intensive care, said the letter, with priority for those with the highest chance of success. Doctors will have to take into account pre-existing conditions, since older, more fragile patients will need longer to recover.
There will be, it says, higher mortality among patients with conditions not linked to the pandemic due to the pressure on health services. And where intensive care is not available or judged inappropriate, difficult conversations will need to be had. Quite sobering. Well, joining us from Frankfurt is Dr. Kai Zacharowski. He is Director of the Department of Anaesthesiology, Intensive Care and Pain Therapy at Frankfurt University Hospital. It's very good to have you with us. This is quite an extraordinary read. I've read most of it today, and I come to the conclusion at the end of it that what is really needed here is a European effort.
Absolutely. I have to say, we as Europe, and that includes United Kingdom, are not prepared together for this unbelievable threat which is coming now. And we are not able, or we have not organized ourselves to organize it in a way that we have everything what we need to treat these patients together. So it starts with ventilators, it starts with certain medication. So we have now some countries who have certain drugs and certain other things, some others they don't. So this is not coordinated, and this is a problem.
We're looking at pictures of the ventilators lined up. I've been challenging politicians here in the UK on the need to make these ventilators. I mean, we've got 4 weeks here. We need all hands to the pump to get the stuff ready that patients will need. Why is Europe dragging its heels in making these kind of things, this kind of essential equipment?
Yes, I think there are two problems. Number one, over the past several, probably 10 years, all over Europe, we were cutting down beds. And we also were cutting down intensive care beds. And suddenly, with a threat like this, we are all realizing, oh, we don't have enough high dependency or intensive care beds. That's one thing. The other thing is that the equipment we're talking about, probably if it would be distributed across Europe at the right time, it would have helped Italy. Once they're over, it could have been moved further on. But now everybody's buying equipment. And the companies who are producing it, they're waiting for the pieces to assemble.
So we're not manufacturing it. We're not manufacturing it in Europe. Is that what you're saying?
Part of it. The parts of the ventilators are coming from China and other countries. And I know it, for example, from several companies in Germany who are producing these ventilators. They're waiting for pieces from China. And that is a problem.
And we've been talking about ventilators. What about medication? Because that has been some of the concern, is that some of the ingredients, as each country goes through their outbreak of the virus, that tendency not to want to then sell medications overseas.
Yes. A lot of our medication, especially antibiotics, which do not help for treating a virus, but most of the antibiotics are coming from India and from China. And you can imagine, if there's a cut, if there's a shortage, if there's any other problem, we will suffer from that in Europe.
Can I ask you one final question? I was explaining to people that the strategy here in Britain now seems to be that we're moving to herd immunity. And maybe you're following that strategy in Germany. Have governments just decided it's pointless to stop it?
Yes, I think that's very clear. And we were talking also the European Society of Anaesthesiology about it. You can't stop it. The only thing you can do is delay it, make it to slow down the whole process, that the actually intensive care medicine beds you have, that you slowly use them, but not at the same time. And I think that's at the moment the only way you can win the whole game.
Dr. Zacharowski in Frankfurt, thank you for that sobering assessment.